Dr. Lee, thank you so much for joining me today. You have an interest in patient-centered design.
I would call myself, I guess, a self-taught designer in that I do think design thinking is really important for problem solving, and I think design thinking is a methodology that should be spread across health systems, brought to patients, brought to healthcare providers, brought to students, faculty and staff. So in terms of what I do, I am a pediatric endocrinologist, and so what that means is that I take care of children with diabetes. I do research that's focused on pediatric obesity and diabetes, looking at health outcomes, but I'm very interested also in thinking about how to integrate design thinking into my research and my clinical care.
So how has your work in design thinking been received by your patient population?
So it's been great. I think patients are very interested. We've been trying to find a number of different ways to engage. So we've had some of these high-level workshops focused on clinical care improvements, but we've also done workshops like, for example, hacking diabetes. So we had kids come together with an artist who has type 1, and we did a workshop at a MakerWorks, which is basically a space that's a place where you can create and make things and technologies. And it was sort of a starting point for thinking about how to engage patients as co-designers in the creation of technologies, tools, and systems for health. We've also done something called the Make Health Fest this summer. So we held our inaugural event, the We Make Health Fest, in Ann Arbor. And what it was a mashup between health and the maker movement. So I think the maker movement is about creation. It's about individual creation. It's about perhaps even non-technical people having the ability to create tools and technologies.
Do you think that pediatric patients are uniquely poised to embrace this sort of idea of design-centered patient care?
Absolutely, because they're creative, right? And they haven't had the creativity beat out of them by the educational system.
It's terrible to say, but I know what you mean.
So, no, it's a logical starting point. We've had great support from Mott Hospital, and we've started with very simple, basic prototypes. One of the prototypes we created was essentially a paper that has a picture of an iPhone on it, and it's sort of make your own app. And I think it's symbolic. Yeah, it's symbolic. But I think it's an important first step in trying to recognize and try and support a culture of making, and to support patients and caregivers in this notion that they can create with the healthcare system to improve health.